Have you ever wondered why medicines come in so many different forms? It's not just about making them look attractive or easy to swallow, there's a lot more science behind it. Welcome to the fascinating world of dosage forms. Dosage forms are how we classify the physical form of a medicine, whether it's a pill, a liquid, a cream, or something else entirely. They're the bridge between the raw chemicals that make up medicines and the patients who need them. Understanding this classification is crucial. It helps us know how a drug works, how it's absorbed, and how it interacts with our bodies. And it's not just for pharmacists or doctors, it's for anyone who wants to better understand what's going into their bodies. We'll be exploring different types of dosage forms, from solids to liquids to gases, and even novel forms like nanoparticles. So, ready to dive into the world of dosage forms? Hold on tight, it's going to be an enlightening journey. First off, let's look at how dosage forms can be classified based on their physical state. The physical state of a dosage form, whether it's solid, liquid, or gas, can significantly impact how it's administered and absorbed in the body. Let's start with solids. Solid dosage forms are the most common and include tablets, capsules, and powders. Tablets are compressed or molded and can contain one or more active ingredients. They're often coated to make them easier to swallow or to control the drug's release in the body. Capsules, on the other hand, are small cylindrical containers made from gelatin that hold the drug in powder or pellet form. Powders are finely ground particles that can be ingested, applied topically, or inhaled. Next up, we have liquid dosage forms. These include solutions, suspensions, and emulsions. Solutions are a homogeneous mixture of two or more substances, with the drug being dissolved in the liquid. Syrups, for example, are sweetened solutions. Suspensions contain fine drug particles dispersed in a liquid, while emulsions are a mixture of two immiscible liquids, usually oil and water, with one being dispersed in the other. Lastly, we have gaseous dosage forms. These are less common but incredibly important for delivering medication directly to the lungs. Inhalants, such as those used for asthma or chronic obstructive pulmonary disease, are a prime example. They deliver the drug in a fine mist or powder that can be deeply inhaled into the lungs. Each of these physical states offers unique advantages and challenges when it comes to drug delivery. Solids are generally more stable and easier to handle, while liquids allow for easier swallowing and can be formulated for better taste. Gaseous forms offer direct delivery to the respiratory tract, but require specific devices for administration. So that was the classification based on physical state. But that's not the only way we can categorize dosage forms. Stay tuned as we dive deeper into other classification criteria in the following scenes. Now let's delve into how dosage forms are classified based on the route of administration. This is a crucial aspect in the world of pharmacy, as it directly impacts how a drug works in our bodies. First off, we have oral administration, which is the most common and convenient route. When we talk about oral administration, we're referring to drugs taken by mouth. These can be in the form of tablets, capsules, powders, or liquids. They are absorbed through the digestive tract and then transported into the bloodstream. Next up is topical administration. This refers to applying a drug directly onto the skin or mucous membranes. Creams, ointments, lotions, and patches are all examples of topical dosage forms. These drugs are designed to act locally at the site of application without significant absorption into the blood. Then we have parenteral administration. This is a broad category that includes any route that bypasses the digestive tract. Injectable drugs fall into this category and can be further divided into subcategories such as intravenous, intramuscular, and subcutaneous, depending on where the drug is injected. We also have other routes like inhalation, where drugs are delivered into the respiratory system in the form of aerosols or gases. This is often used for conditions like asthma or chronic obstructive pulmonary disease. And let's not forget rectal and vaginal administration, where suppositories or creams are introduced into the rectum or vagina, respectively. These routes are used when oral administration isn't possible or to achieve local effects. Lastly, we have transdermal administration, where drugs are delivered through the skin for systemic effect. Transdermal patches are a common example of this route, and that's how we classify dosage forms based on the route of administration. But there's still more to cover, so stay tuned as we continue this fascinating journey through the world of pharmaceutical dosage forms. Scene script. Another way to classify dosage forms is by their design. Intrigued? Let's explore. First up, we have immediate release dosage forms. As their name suggests, these are designed to dissolve and release their medicinal components as soon as they enter the body. They are the most common types of dosage forms and include tablets, capsules, syrups, injection solutions, and more. The primary goal of immediate release dosage forms is to ensure that the drug is quickly absorbed into the body's system, providing fast relief or treatment. Next, we have delayed release dosage forms. These are a bit more sophisticated in their design. The purpose is to delay the release of the medication until it has passed through the stomach. Why, you ask? Well, some drugs can be destroyed by the stomach's acidic environment, or they may cause irritation to the stomach lining. To prevent this, delayed release dosage forms like enteric-coated tablets or capsules are used. They have a special coating that only dissolves in the less acidic environment of the intestines, ensuring the drug is released where it can be most effective. Lastly, let's talk about controlled release dosage forms. These are designed to gradually release the drug over an extended period, providing a sustained therapeutic effect. Controlled release dosage forms are beneficial in maintaining steady drug levels in the body, reducing the frequency of dosing, and improving patient compliance. Examples include transdermal patches, implantable devices, and certain types of tablets and capsules. In essence, the design of the dosage form plays a crucial role in determining how, where, and when a drug is released in the body. The ultimate goal is to ensure that the drug is delivered in the most effective and safe manner, optimizing its therapeutic effect while minimizing side effects. That concludes our classification based on dosage form design, but we're not done yet. Finally, let's look at how dosage forms can be classified based on pharmacokinetic parameters. These parameters are the fundamental pillars of pharmacology. They define how a drug behaves in your body from the moment it enters until it is completely eliminated. Let's start with absorption. This is how a drug makes its way from the site of administration to the bloodstream. Depending on the dosage form, this could happen in a variety of ways. For example, oral medications are absorbed through the stomach or intestines, while intravenous drugs bypass this step entirely, delivering the drug straight to the bloodstream. Next up, distribution. This is how the drug gets around your body. It typically travels through the bloodstream, reaching the organs or tissues where it needs to act. The choice of dosage form can significantly impact how well a drug is distributed. For instance, some drugs are better absorbed when taken orally, while others may be more effective when delivered directly into the bloodstream. Now, onto metabolism. This is the process where the drug is broken down, usually in the liver, into substances called metabolites. Some drugs need to be metabolized to become active, while others are active already and are metabolized to be eliminated. The dosage form can influence the speed and extent of this process. And lastly, excretion. This is how the drug leaves your body, usually through the kidneys and in your urine. Certain dosage forms can affect how quickly or slowly a drug is excreted, which can influence the duration of its effects. Each of these parameters, absorption, distribution, metabolism, and excretion, plays a crucial role in determining the most appropriate dosage form for a particular drug. They help ensure that the drug is as effective as possible, with the least amount of side effects. That wraps up our classification based on pharmacokinetic parameters. Fascinating, isn't it? So, what have we learned today about the classification of dosage forms? We've navigated through the fascinating world of dosage forms and their classifications. We've discovered that dosage forms can be classified by their physical state, ranging from solids such as tablets and capsules, to liquids like solutions and suspensions, and even to gases like inhalants. We've also explored how dosage forms can be differentiated based on the route of administration. Whether it's oral, topical, or parenteral, each route has its own unique set of dosage forms. Next, we delved into the realm of dosage form design, understanding how the design of a dosage form can impact its effectiveness and patient compliance. And finally, we've looked at pharmacokinetic parameters, shedding light on how dosage forms can be designed to control the rate, extent, and duration of drug release. And that, my friends, concludes our journey through the classification of dosage forms. Subscribe for more insightful content like this. Until next time, stay curious and keep learning.